Hello and welcome. I'm here with Dr. Kwadwo Kyeremanteng today.
Dr. Kwadwo Kyeremanteng is a critical care and palliative care physician at the Ottawa Hospital, where he is the department head. He obtained his Doctor of Medicine degree at the University of Alberta and has his Master's in Health Administration from Dalhousie University. Dr. Kyeremanteng's research interests include using ICU resources more efficiently and improving access to palliative care in the ICU. He founded the Resource Optimization Network, which is a multidisciplinary research group working to reduce health spending without compromising care. He is also the host of Solving Healthcare, where he interviews and discusses different topics concerning the improvement of healthcare delivery in Canada. I hope you'll enjoy this very insightful and optimistic interview with Dr. Kwadwo Kyeremanteng.
Thank you so much for joining me today.
Lindsay, I feel like we have we've met before, even though we haven't, since I've seen all the magic you're doing with Friendly Pharmacy and the magic you're doing on social media. I'm totally privileged and happy to be here. Thanks for having me.
Oh, thank you so much. I'm so excited to talk to you because you are doing some incredible things. You're a palliative care physician, an ICU physician, but you also have some other really interesting work going on that I definitely want to talk about in a little bit here. But first of all, could you just tell us a little bit, you are in Ottawa, Canada, and can you tell us a little bit about what the vibe is there right now? We're 15 months into the pandemic. Vaccines have been rolling out pretty strong at this point. What is it looking like right now in Ottawa? What is it looking like in the ICU from your perspective?
Yeah, Lindsay, it's been like we're at the end of June here at the time of recording, and it's been very promising. Like it's been such a 180 compared to a couple months ago when we were in the heights of the third wave, receiving patients from the GTA, adding extra staff, pulling staff from different areas of the hospital. Mm-hmm. From the physician standpoint, we had an extra doc at every site, one staying in-house, which, I haven't stayed slept at hospital routinely since I was a trainee. So it was quite different. But yeah, now it's complete 180. We are, I think a couple of our sites have no COVID patients in the intensive care unit.
Wow.
We are exhaling essentially, which has been great. It really has shown the incredible efforts that have been put out for getting our citizens vaccinated. Being at this stage where there's minimal spread within the community, we're not seeing many in the ways of admissions. It's been honestly a complete 180, and this huge exhalation you could feel amongst our healthcare providers has been incredible.
Yeah, because Ontario was one of the provinces, I think, that were the worst hit in all of Canada. So you must have seen some burnout from healthcare professionals. I mean, nurses, doctors, support staff, right? And so did you see that a little bit, or what was the...
Unfortunately, this was, I think in the heights of it, we were all just putting our heads down and just getting through it kind of thing. But as we kind of started to get on the other side of things, you definitely saw, people starting to pull away in certain ways, like they're retiring earlier than expected, leaving the intensive care units for different parts of the hospital, like, for example, recovery room or endoscopy, for example. So we're definitely seeing people pull away. It's actually why we started this wellness program called Solving Wellness, and it was meant to be launched in September. But based on some of the feedback and response we were seeing within our community, we thought maybe we should launch this bad boy sooner. Just even if it prevents one or two people from burning out, I think it would, it really would have served our community. But yeah, I hate to say it, Lindsay, I think there's a lot of burned out healthcare providers, and I know on the physician side, I think haven't really, in our small groups, we haven't seen it yet. But I think what we are really trying to do is lay out some recovery time and really, not plan too much in the summer. Even I took over for department head as of July 1st.
I saw that. Congratulations, by the way.
Oh, thank you very much. And one of my agenda items is just to make sure that we really have that time for recovery, minimize meetings, minimize new projects, even
Yeah.
coming into the fall, just so we could all kind of regroup.
And I'm not sure what the situation is like in Ontario, but I know that in British Columbia, for example, we already had a shortage of nurses. We already had nurses that were already burning out before the pandemic. That was one of my big concerns when the pandemic hit, is we were all putting hearts up in the windows and supporting our healthcare workers, and that's great. But also I was concerned because I have friends who are nurses, physicians. They were already close to burnout and just had to really, really push to get through it.
Oh, absolutely, Lindsay. Like, I guess, yeah, part of the story I forgot to mention was people left during post first wave, post second
Oh,
wave,
wow. Yeah.
so there was a real shortage. And so what ended up happening was we would pull the nurses back into the ICU, even though they were in different parts of the hospital, just for that third wave. And, I think one of the gifts of COVID has been to put a lens on the work that is done in the intensive care units. Like, I gotta give some mad props to my nurses, the physiotherapists, occupational therapists, PCAs, respiratory therapists, especially during COVID. Like, people really have no idea what kind of extra mile these people are putting into the emotional, physical toll, the moral distress that can happen with this job. And so to have that lens and to have that gratitude for the work that they're doing, I think certainly it helped. But it's a tough job, it really is. Whether it's a COVID patient that you're seeing dying alone, whether it's a young patient where you've done everything you can to try and prevent them from dying, and they die anyway. It's stressful and the hours are long. But luckily, overall, I think most people that get into this kind of work are a resilient group, and something that I think has gotten us through these crazy times.
Yeah. And it's something that's really stood out to me. I mean, I do listen to your Solving Healthcare podcast. Now you're doing Solving Wellness. And it's easy for those, I think, who listen to you to forget almost that you are an ICU physician, because you're so upbeat, you're so positive. And oftentimes I've thought, man, how is this person, this doctor, doing this type of work? And then at work, you are seeing such critical patients. It's really intense. It must take an emotional toll as well. If people who listen to you and watch you would think that doesn't affect you, but I'm sure it does.
Yeah, thank you so much, Lindsay. I mean, it absolutely does. Like, I always find it, I always say my most challenging patients are the ones that I always find young moms, for example, the ones I find hardest to emotionally, because they have so much. Like, if the young moms pass, it's like so many people are involved, their kids, they still have siblings, their parents, and you could just see how impactful that death can have. And for me, it comes down to is like, this is a way I've always tried to lead. Like, I think having that positive outlook doesn't hurt. It can provide energy, it provide hope. And I think at times when you need to be engaged for an emotional level, when it's upsetting, it's sad, it's important to be there. But it's also important to be able to, like, compartmentalize when need be. Like, when you're sitting down with that family of that 39-year-old mom that's passing, and then a trauma comes in, you want your head in the game. Your head's got to be ready to go and address that, the bleeding, the airway, all the resuscitation, all the important aspects to deal with that life in front of you. Otherwise, you're not serving that patient right. So so to be able to compartmentalize is an important part of the job. But that positive messaging, that positive outlook, like I always say, Lindsay, like, think about I don't know if you were an athlete growing up, but if you had a coach, when there's a coach that was like, you could do better, get off your butt, let's get going. Or there was like, Lindsay, you got this. Just put a little bit of focus in this. Remember all those hours practicing. This is what you're here for, and we know you could do it. And those are the coaches for me that really made me amplified my game, and so to me, that's a way to lead. That's a way to address your team. This is a way when you communicate, even leaders, when it comes to hard times. If you think historically, leaders weren't going on in a time of war being like, man, you guys need to do better. We're in trouble here. Like, I wish you guys would just listen, as opposed to like, hey, let's pull together. We got this. We need you at this time to pull through. This is what we need you to do to get us through, but we will get through. I just think this is like the ABCs of trying to get people through tough times, but it seemed like it was lacking during our pandemic, unfortunately.
Yeah, and I think we saw that in a lot of different areas. We kind of missed a few basic principles. I think we got some things done pretty well, but I think that also there were some struggles. And we're still working on it. I think. So I wanted to talk a little bit about, we're talking about your experience in the ICU. And could you tell us, so for the public, for people who don't really understand, I mean, now in Canada, we have capacity in our ICU. And so some people may think, well, maybe I don't need the vaccine because the ICU now has room for me and, I'll be taken care of. I mean, how bad does it have to be for someone to get into the ICU? And what does recovery look like after that? Because I've heard some pretty terrible things. I actually looked at one of your research papers talking about recovery after ICU, and it can be pretty staggering.
Yeah, absolutely, Linda. I got to tell you, as a guy that lives and breathes in the ICU, this is the last place I would ever want to be. It's great because we could salvage life or what have you, but the toll that it takes on you is incredible. Like, just to give you an example, the traditional patient that has ARDS, like if you, even at the age of 25, 30, their lung capacity, their ability to even walk up steps is significantly impaired even a year after their discharge.
Wow.
And so when you look at COVID, man, like it's scary. Like I won't lie to you. Like I was there in the early stages. I was there when our first patients rolled into our ICU, and and this was a fearful time because we didn't know what to expect. But watching these patients go through what they go through, being able to communicate, a bit short of breath to extremely short of breath, to be put on a ventilator for not a short period of time. Like that was the thing that I don't know if was portrayed in the media, by the way, is the recovery on a ventilator was not short, not like your typical pneumonia or other respiratory illnesses. So, it wouldn't be uncommon for somebody to be on the ventilator for 3 weeks or more. And so the amount of deconditioning, the amount of complications as a result, you get another pneumonia, you get a blood clot in your leg or in your lung. You might have new infections or might have a sacral ulcer, all these things, and yes, some people unfortunately pass, but even the ones that like pulled through, their life wasn't easy. Like some of these people a year later, like we, would still need a lot of oxygen. They would have right-sided heart failure. So basically the right side of their heart was not functioning as well as it could be, and so this is not an easy thing to go through. They had delirium or confusion, which I don't know about the long-term impacts of that because, we don't see the patients long-term, but, all these things is what you potentially could go through. And, I think I'm not one to shame people into taking the vaccine. But one thing I'll say is how effective they are at preventing them from seeing someone like me is incredible. Like, honestly, I think in our wildest dreams, when we looked at the impact that the vaccines could have on outcomes that matter, like outcomes on being like hospitalizations and death, absolutely incredible. And and so like this is why I tell people, that if you are serious about trying to avoid coming into a hospital with COVID or preventing it from giving it to somebody that's more vulnerable than you maybe, this is something that is absolutely fantastic. And yeah, and as a way of kind of encouraging it, especially in the Black community, there was a lot of hesitancy. You know, I got my vaccine. I was blessed to have my vaccine relatively early, and yeah, I posted on social media just to say, like, you know, I believe in the science, I believe in the impact that this has, and so, you know, this is why I'm doing this. You know, I just wanted to say, like, I'm one of you. I'm doing this now, and I have full confidence in safety and its impact. But I think it's such an important message, Lindsay, to continue to propagate the value of the vaccine and how much impact it could truly have.
Yeah, and all the vaccines that we do have are very effective. We are seeing that some people might be giving a preference to one or the other, but the efficacy is, I mean, they're so similar. The efficacy is very comparable, and the protection, like you said, against severe disease, hospitalization, and death is exceptional.
I do think it was one of the things that we really did not serve the public well on, is, you know, the language we were using. I don't know if the language or just spewing out numbers on efficacy, and when like the general public really didn't know what that means. Like, if you knew you could get Moderna or Pfizer, which, I mean, maybe that's not a best example because they were so similar, but, you know, 2 doses 95% versus 93% or whatever on mild disease, like, people weren't fixating on the mild disease. There was, I don't know if people knew that, listen, if you look at those studies, only one patient on the 130,000 was hospitalized. I'm like, isn't that what you care about? Like, that's what I care about. I just don't want to die from this bad boy or come into hospital from this bad boy, or my loved one having to go into hospital from this. And so, I mean, that was the numbers to me that were the most important. But yeah, I think we didn't serve the public well when it came to the communication or messaging.
Yeah, and I think it's hard for the public. It's even hard for people in healthcare or scientists to keep up with the data, and also for the public to interpret this data. I mean, as a pharmacist, I've never had to, you know, ask patients, well, have you done your research? Or, you know, we've never talked about efficacy other than if we give them a flu shot, we'll say, well, this is the general efficacy, and that's kind of the end of the conversation. But when you have clinical trials coming out and you're comparing them, and, you know, there's, how does the public interpret that, right? If you haven't had experience interpreting clinical trials. And so I think, yeah, the emphasis was definitely, or the emphasis in the communications definitely could have been better. So that's definitely a learning point.
Yeah. And like, let's get ahead of this game. I mean, I got a bit of envy. I think Bonnie Henry has been an absolute legend when it comes to communication, clear communication, positivity when appropriate, and then just overall approach to COVID. But I think we could easily like dealt with this early on, unfortunately. But you know, we are where we are, and unfortunately, we're in actually a really good spot in Canada in terms of first and second doses.
Yeah, we're doing great. I think we're over 70% now for first doses. I think we're around 20 for second. So we are in a very privileged place right now. So thankful for that at the moment, right?
Absolutely.
So Dr. Kyeremanteng, one other thing that I wanted to touch on with you is you have been throughout, I think, most of the pandemic, fairly outspoken about the different public health measures in regards to schools and concerns with children and mental health. And you haven't always agreed. I mean, none of us have always agreed with necessarily with certain public health decisions. But could you speak to that a little bit? I know that in Ontario, schools have been closed for a couple of months, and they're not reopening. Obviously, we're in summer now, right? What have your concerns been there, and missed opportunities maybe?
Yeah, no, that's a great question. And for me, Lindsay, you know, my research area is always on, I do a lot of cost evaluations. So you know, cost benefit analysis. You got to look at both sides of the coin of any intervention, right? Like in terms of, yes, your intervention might reduce COVID cases, for example, but at what cost?
Yeah.
And so, you know, for me, from a research point of view, I'm wired that way. And as an intensivist too, you can't single out a system, right? Like if someone comes in with, a kidney issue, you got to think about how your intervention is going to affect the heart, how it's going to affect the lungs. Like you got to look at things holistically. And this was my concern during the pandemic. I'm like, yeah, we do what we got to do at the beginning, but now that we have more information, what are we going to learn from that? Because we got to figure out what impact it's going to have on, mental health, substance abuse, delayed cancer diagnosis, and all these things. And then how are these things going to affect our children? And for me, when it comes to, like, I'm big on justice and making sure people have a voice, but kids is where I draw my line, where it's like the gloves come off. Like we got to be able to advocate for our children. And when the data was coming out fairly, in my opinion, pretty clear that schools weren't a major source of spread, kids were less likely to cause secondary attacks relative to older adults. When the data was coming out to kind of support that schools should be open, and then adding the fact that the negative impacts that were coming out clear, like child abuse, some of the data in the states showing that virtual learning has been quite ineffective. I was like, whoa, we gotta like really rejig this thing. Like we gotta think about this. Economic impacts too. Even the idea that some of our healthcare providers couldn't be available because they have to sort out childcare for themselves. And my wife's a psychologist. We're good friends with a child psychologist, and hearing what they were seeing overall on families, and then more importantly on children, I was like, this is too much. This is too much. We gotta amplify this concern. And so we went out on the offensive. Much to my chagrin, didn't change anything, but at least in this third wave, I think we did see a positive impact, not directly from us, but just overall the message in that second wave when schools reopened. But man, it honestly breaks my soul a little bit. When you think about those kids that can't fend for themselves, people that are living on the margins, and what it's meant to not have schools open. Like one of the initiatives we started was a charity called Bridges Over Barriers, where we try and give kids the basic needs to get by. And it's really, once again, it was something that was going to come to fruition later on, but because of the needs during the pandemic, we launched that bad boy. And I'm super grateful we did, because the amount, I think we're got to be approaching 500 families that we've helped, over 120,000 raised.
Wow.
But when you hear these stories about diapers versus food for some families, homeschooling versus a job for some families, it's like, we got to do better, man. Like where are our values? If you can't stick up for kids, who can you stick up for?
Definitely. Yeah. I remember one point that really just broke me was, and I think it was Ottawa Health put out a notice, I think it was maybe 6 or 7 months ago, saying that they're seeing more shaken baby syndrome and this kind of thing. And I was just like, well, like, we have to speak for those who can't speak, right? And I do think the ramifications of COVID, I mean, yes, we did have to close a lot of things in the beginning. We didn't know what was going on. But we are now responsible to kind of now pick up the pieces. I mean, there's been missed opportunities, but moving forward, we definitely have to have a wide angle lens and see all of the different groups that have been adversely affected, because not everyone gets to stay home and work from home and kind of continue on, and not every child is safe at home, right? There's so many factors, and you're totally aware of that.
I know, but absolutely. I just I like that analogy, having that wide lens. Increase our perspective, because a lot of people making decisions have the luxury of working from home, have their Zoom calls, as opposed to having their job threatened by our actions.
So Dr. Kyeremanteng, you started the Resource Optimization Network, and what is this? This is, I was looking, I mean, I was doing some research before our interview. You know, you have done a ton of research on inefficiencies in healthcare. And I think you have over 124 papers or something like that published, that I could find anyways. And you started this resource optimization network. What is this? What are you doing?
Yeah, no, thanks for the plug, Lindsay. It was actually what what launched my what got me interested in academia was I was just seeing a ton of inefficiency in the healthcare system, and I saw what the opportunity costs were. Like the story I often give was seeing a trauma patient that was heavily reliant on chest physio during a time of cuts. He was paraplegic, I believe, and he was heavily reliant on chest physio. This was a long weekend, no physio available. Develops a pneumonia, plugs his trach, and comes back to ICU for another 3 weeks. Seen a scenario where, you know, we don't address goals of care early on a patient from a long-term care facility that's got multiple comorbidities like dementia, heart failure, all these things. And because we haven't addressed goals of care early enough or made sure their documentation was in order, they just literally went through like care they never wanted. Meanwhile,
Wow.
like spending like $15,000 into the healthcare system based on things that we could have prevented. And so I look at this and I was like, we got to do better overall. So we just, end up doing a master's in health admin. I made the call. I'm like, you know what? Let's make this multidisciplinary team. We got pharmacy, we got nurses, economists, members of Telfer School of Management, and let's see what we could come up with. Let's see if we could look at some studies and look at what's out there, and just let's publish and get the word out that we could be doing a better job at making healthcare more efficient and less wasteful. And so we could really put money into things that make a difference. And that's what started our research program. And then what I noticed, Lindsay, ironically, was that nothing was changing despite being able to publish in good journals and so
change is hard. Yeah,
it is. But it also, the other thing to me is I'm very impatient, and I do think there's within healthcare, especially amongst physicians, we don't like to think outside the box too much.
Sure.
And so, our group said, why don't we start a podcast so we could really start to promote like knowledge translation, like get the word out in a different fashion. And obviously the podcast changed my life, but also it was such a better way at delivering more people some of these messages. And I must say the podcast probably changed in the way I thought it was gonna pull through, but what we did was just focus on a lot of what was on the minds of many Canadians, and a lot of that was COVID. And so I feel like half of our episodes have been COVID related, but then it was really enlightening to see the value of like healthcare prevention and making our citizens healthier. And I'm like, this is the most efficient way of saving healthcare dollars and improving the well-being of Canadians, is get them healthy and prevent them from landing in ICU, which, by the way, people, cost 1% of your gross domestic product. This is the kind of funds that we're talking about to take care of critically ill patients. And so if you could prevent them from walking in the door, let's do it.
Yeah. Well, and this whole conversation about efficiency, often we hear people saying, well, we need more funding, but there's so many inefficiencies. And that's probably the biggest culprit. And we see this in the pharmacy all the time. We see people coming in and they're kind of lost in the system and they're waiting to see this specialist. And by the time they get to see that person, they kind of don't really need to see that specialist anymore. You know, like, and so much, I mean, there's lack of communication, so many opportunities, I think, for increasing efficiency. And also, like you say, keeping people from getting sick or preventing them from getting sick, giving them the resources that they need to stay out of the system, right?
Yeah, absolutely. I mean, when it comes to pharmacy, oh my God, you don't even get me started.
Yeah.
Instead of IV antibiotics when the bioavailability is the same. We're looking at even like some of the sexy inhalers, you know, that are cost $100 per inhaler. Patient can bring in their own inhaler, and often we don't need the inhaler in well, at least in ICU, we don't need their Advair. You know what I mean?
Yeah.
Like they're already on corticosteroids. Like I could go when it comes to drugs, I could go on and on and on. But there's definitely room for education. And the other thing, Lindsay, that one of the studies, I don't know if it's published yet, but when we survey healthcare providers about the cost of specific stuff, they have no idea. They have no idea. If you said IV Pantoloc versus PO Pantoloc, that's a proton pump inhibitor, no clue. They're like, well, maybe it's roughly the same. Like only 30% of surveyors or people surveyed were roughly in the ballpark, within 25% of the ballpark.
Yeah. Well, I think, there's a lack of education and also a lack of motivation. Like, why do I care about this? Why should I care, right? I love how the resource optimization network is multidisciplinary, because you really do need the whole team, right? To look at this from all the different angles and to really pull people in. And I love the work you do. You know that because I keep telling you this is amazing, right?
Oh no, well, thank you.
But I mean, you're really helping people and really looking to make a difference and to get the people who are kind of lost in the system. And yeah, it's excellent.
No, thank you. And the multidisciplinary is so important because it's perspective. There's stuff that would never come on my radar. Like
totally.
The reason I mentioned the inhalers, because recently one of our pharmacists brought that up. And I would never have registered.
Yeah.
$100 and something for one of those sexy inhalers that we prescribe and we'll never use. Like, come on. Yeah. So like, it's been very enlightening having the different perspectives.
Yeah. And then one last thing, the way that I found you, Kwadwo, online is at the beginning of the pandemic. I think it was maybe March or April. Everyone was just concerned about COVID. And so we're talking about, at that time, it was like, should we mask? Should we not mask? We don't know. We don't do this in Canada. Should we distance? And then you were on your podcast talking about ketogenic diets, talking about getting healthy. And this was a huge concern for me at the time because there was questions about, should we lock down? Should we not? Have we done the right thing? And I thought, well, I think we need to lock down because over 40% of Canadians have a chronic illness, many more than one. We are very sick. And I said, who is this guy? Who is this person that I've never heard a healthcare professional in Canada talk like this about preventative medicine or just about getting healthy, and whether it's a ketogenic diet or whatever it is, the work that you were doing, I almost think you were a little bit ahead of everyone else, right? But talk about where that came from, because you were in the ICU, but you were also doing this other work.
Oh, well, thank you again, Lindsay. And this is something that I developed a passion for because from no experience of my own, like I don't do any keto or low carb. I fast, like time restricted eat just out of convenience.
Sure.
But what was clear early in this pandemic was poor metabolic health. Like if you have diabetes, obesity. Hypertension, one of these or all of them.
Yeah.
They were clearly the ones getting sick with COVID. It was abundantly clear early on.
Yes.
And even to the point where one of my colleagues, Tom Saras, he saw what was going on and he was like, I'm losing weight. lost 30 pounds in a
I
relatively
saw.
short period of time.
Mhm.
And it was like, and so, in medical school, we don't learn about these things. They tell you the classic ways to lose weight, or they often say, like, if you got type 2 diabetes, it's not going to be reversed. And so the show, or fans were pointing me towards like some of these content experts on how to reverse metabolic disease quick. And I
Mhm.
was shocked. I was literally, I wish you could see my face during some of this. When when I talked to, whether it was like Ken Berry or Brescher, about reversing diabetes in 2 weeks, I was like,
Yeah.
what are you talking about? And
Yeah.
then then your ears open, then you hear about, like colleagues or colleagues' parents that did the same thing, went low carb or went keto and lost, and are now off their diabetic medications. And it's like, what the hell is happening? I'm like,
Mhm.
okay, so we know that, and this, remember, people, this is before vaccines were
Oh
even
yeah,
like,
way before.
even we're talking about them realistically.
Yeah.
And so you see people with poor metabolic disease all the time, and then they're giving you solutions to address metabolic health,
Yeah.
and we're not talking about it at all. So I was like, what the hell? So I did everything I could to get the word out. Had a low carb keto summit. Did a bunch of shows on the topic. Really just started. I went to media. Every media time I spoke with mainstream media, I'm like, do you guys know this? And I would give them, pump up the information, and it's not sexy, so no one really bid on it. Did an op-ed, did everything I could, and I still, to this day, I'm still shocked that we don't talk about this more. Like,
Mhm.
even this third wave, Lindsay, the patients that, I don't know if this got to the mainstream media too. Like, I saw a couple patients, younger patients, and even ones is in their 20s and 30s. But if you took their average weight, they weren't, like, they were obese. Like,
Okay.
we had a few patients that were over 300 pounds.
Mhm.
Like, and yes, they were young and weren't on any medication. Some people would say they're young and healthy, but they were far from
Mm.
healthy.
Interesting.
You know what I mean? And I don't know if that ever made mainstream media at all, but
Mhm.
holy cow, that needed to be part of the narrative there. It's like,
Mhm.
especially post first wave, it would have been great if we all were just like, okay, let's acknowledge this. What can we do collectively? Are we going to be walking outside post meal? Are we going to
Yeah.
be avoiding processed foods? Are we going to, like, add resistance training to our regimen to try and improve insulin resistance? Like,
Yeah.
all these things that we could have been doing or
Mhm.
talking about, but
Mhm.
it was not on anyone's radar.
Mhm. Mhm. And I think that the more conversations we have about this, though, the more that it will become part of care, right? And part of the way that we provide healthcare to people. I hope in a more preventative way. And you're a huge have. I think you've had a bigger impact than you think, and maybe we're just starting to see that. But the conversation is definitely ramping up, I think, across Canada. Well, this has been so great, and just as we move forward, Kwadwo, and I mean, I did an interview recently. We were talking about how many Canadians have gained weight actually during the pandemic, right? Substance abuse. A lot of people have been drinking a lot more alcohol. I have huge concerns that we weren't really healthy before the pandemic. Now we're kind of even in a worse situation. Moving forward, what's the kind of work you're going to do maybe on your podcast, or what's your message to Canadians now regarding health? I mean, I just love to bring people on the show here that are looking at healthcare differently and from a more preventative lens. So what's going to happen with Kwadwo over the next year here?
You're gonna see. You're gonna see more and more chatter about prevention, and it
Great.
even starting young, like talking about how socioeconomics matter, how supporting our community, having a more walkable city, having
Mhm.
kids that make sure they have a healthy breakfast,
Yeah.
encouraging physical activity, and so it's really trying to show how that matters and how that investment could lead to improved future outcomes. Yeah,
Absolutely.
and in terms of getting Canadians healthier, just knowing that whatever your body shape, your genetics, there's a lot of support out there. There's a lot of ways that we could try and improve your health. And we're not, I'm a big believer of personalized medicine. Like there's not a cookie cutter solution to everything, especially when it comes to improving your overall health.
Yeah.
But man, we need to make a push for this. And so my research interest is certainly going to be moving towards, hey, how do we use our current technology? How do we use, the virtual space, for example, to engage more Canadians in terms of, hey, what do you need? What can we do to help you get into a healthier state? So, whether that's more on the exercise, whether it's more nutrition, I think health coaching is going to be becoming a bigger and bigger piece of healthcare moving forward. But I just really, for me, Lindsay, is just like have it on everyone's radar that, no matter where you're at in your health journey right now, it could be better. We got to give you the tools to continue to do that. And then I really, for my colleagues, really trying to do our best to reduce burnout and address that. And so, we'll be giving away, actually, for Friendly Pharmacy, we're going to give away like 10 memberships to Solving Wellness for those in the pharmacy community or that are healthcare providers, for sure. Because once again, this is a big motivation for us, is to make sure that we're in a good state so we could take care of our patients and clients.
Amazing. Well, thank you so much for all the work you've been doing in the ICU, on your podcast, in your research. Thank you for sharing your time with us today. And we will put all the links to all of your work in the description of the video. People will know where to find you, where to get connected, and that sort of thing. So thank you so much, Dr. Kyeremanteng.
Can I just give you a quick shout out, Lindsay? Thank you for your hustle throughout this pandemic as well. Reliable, consistent information that people could digest. Your dedication has been really influential. Knowing that there's other people out there that feel so strongly and passionate about getting our citizens informed and giving them that reliable information. So kudos to you, Lindsay, and keep it up. You got a big fan over solving wellness and solving healthcare communities. So thank you.
Thank you so much. Okay, all the best to you.
All the best.
Bye-bye.